Hey guys, Dr. Andy here. Today we are going to show you dry needling for shoulder pain. Okay, this is especially useful for our rotational athletes. We see a lot of tennis players and a lot of golfers, especially in the springtime, and it's almost kind of warming up around here. So we are going to use Mr. Connor here as our model, right? So he's been complaining a little bit of some shoulder problems as well. So this is perfect. We are going to show you how we dry needle our shoulder pain patients, especially our rotational athletes that play rotational sports. So tennis, golf, baseball is another one, okay? So this is especially useful for our patients that have pain and loss of mobility. It does even help some of our instability type patients for shoulder, because it does speed up healing as well, okay? So it helps, three awesome things that it can do. One is it can kill pain, all right? So it does a really good job of actually kind of muting the pain signal from the shoulder to the brain. So number one, it stops pain. Number two, it speeds up healing, and it does that by increasing the speed of blood to the shoulder area. And whenever you bring more blood flow to a injured area, you actually bring all of the stuff along with it that flows in your blood that's useful for healing, okay? So it speeds up healing. Lastly, it really helps with range of motion. So for all of our patients with some pain, and also it feels like, I can't lift it up past, 90 degrees. It just feels like it's really stiff. Dry needling is a fantastic technique that we use for our shoulder pain patients, okay? So dry needling, very similar to acupuncture. We actually use the same kind of needles. The needles themselves are actually the width of a human hair. So it's not a lot. We put 5 needles themselves into the shoulder blade area itself, and we're actually aiming for the different muscles of the rotator cuff. We're doing the supraspinatus and, oh Lord, sorry, off the top of my head, forgot. Subscap, sorry. No, excuse me, infraspinatus. I'm so sorry. I do know. And we're gonna do one more into the supraspinatus, but normally we do 3. So just showing you where they go, right on top. Perfect. And then we do 2 more. We do 1 into the deltoid, so the outside portion of the shoulder. There we are right there. Perfect. And then lastly, 1 into the tricep. Right along the side. Perfect. And it's literally that simple. When we do this for our patients get to hang out for about 10 minutes with the needles in. Sometimes 15 minutes depending on what we've done. And usually we have awesome results, meaning right after this, Connor is going to probably come up off the table when he's done in here, and he's going to move that shoulder around, and he's going to feel great, all right? So again, this is dry needling for our shoulder pain patients, especially useful for our rotational athletes, think our golfers and our tennis players. If you have any questions, send them my way, and always remember to live with passion, not pain.